If you have a symptom of COVID-19, Governor Asa Hutchinson wants you to get tested now. Thanks so much for joining us tonight at 10. I'm Marlisa Goldsmith. The governor announced a 2-day testing surge this Friday and Saturday. THV 11's Marlisa Goldsmith spoke with the Department of Health about who is most likely to receive one.
Yeah, testing sites like here at UAMS will most likely see an influx of people coming Friday and Saturday. But just because the governor wants more people to get tested still doesn't mean that anyone can get one. Governor Asa Hutchinson wants to increase testing to at least 1,500 people each day this Friday and Saturday. That's up from about 1,000 a day.
We are currently not fully utilizing the testing capacity in our state.
Between the private labs, UAMS, and the Department of Health lab, the governor is confident less people will be turned away.
If you have symptoms like fever, cough, or shortness of breath, get tested for COVID-19.
People should call ahead wherever they decide to go.
Dr. Jennifer Dillahay with the Department of Health says to go get tested even if you are only showing 1 or 2 mild symptoms.
They don't have to have a fever.
Now, what if someone feels healthy but they believe they may be asymptomatic?
Right now, we don't have the capacity to test everyone. But if someone has a history of possible exposure and they're asymptomatic, then we would encourage that to be tested.
Just make sure to tell the nurse you've had contact with someone who tested positive.
And then we could follow up and see who their contacts are and perhaps test the contacts.
The cost of the test should also not be turning people away, even if you don't have health insurance.
Any testing site should take them without any hesitation, because that's a commitment that we have, that there's not a cost.
In Little Rock, Marlisa Goldsmith, THV 11 News.
There are dozens of screening and testing locations across the state. You can text the word TEST, T-E-S-T, to our number 501-376-1111 and we'll send you that information. 2,599 total cases of COVID-19 and 45 deaths have been reported in Arkansas as of tonight. 101 people are currently in the hospital, 24 of them on ventilators. The good news here, 922 Arkansans have recovered from the virus.
The skies are clear, but temperatures are dropping down into the 50s. Radar is all quiet at this time. 24 hours from now, I think it's going to be lighting up like a Christmas tree as our next chance of severe weather will be approaching. As we take a look here, tomorrow, most of the day is going to be quiet. We'll see a mixture of sun and clouds, more clouds through the afternoon, but the chance of storms and strong to severe storms won't arrive here in the natural state until about 6 o'clock and through midnight. This is what the radar could look like. You can see a solid area of some nasty storms, certainly a possibility in eastern Oklahoma, moving into western parts of the state. 7 o'clock, that line continues to shift its way to the east, say around 9 to 11 o'clock for most of central Arkansas, and then it's out of here as we go into the early morning hours. Looking at the threats, the highest threat is going to be for western parts of the state. And everybody has a low threat of severe weather, but the higher threat is the orange zone. That's where we can see some supercells. Main concerns will be large hail, damaging winds. A tornado cannot be ruled out. I'll have more details on this map and let you know what to expect for this weekend coming up.
New York is the epicenter of this pandemic, and tonight we want to show you a perspective that not many people get to see. Cameras were allowed inside a New York emergency room as people fight and sometimes lose their battle with COVID-19. Now we want to warn you, the video is intense.
All right, let's go. Hold the curtain, please. Hold the curtain. Okay, move. Everybody move. Everybody out. Up, move. Clear. 300. Charge. Charging. Okay, you're okay, every quick. Good. Yep. Charge. So continue CPR. 300. Everybody move. Don't lose this. Everybody move. We do this all day, every day for the last month. We do this, this team does this multiple times a day. It's a tough one.
It's been a nightmare. We have a volume of sick people like you can't believe. In one shift, I pronounced 6 people dead. Many were elderly, but then that's not uniform across the board. There are plenty of other people that you would not think would succumb to this who unfortunately have. I've been in this business for over 20 years, and to a person, no one has ever seen anything like this.
Go ahead and get the ABG now.
Yeah.
Is in
Yeah, I would get the
good
ABG.
position?
Yeah. It's in a good spot.
We can't be overconfident until we have some measure of being able to say it's in the past. Because if we get too anxious and we let our guard down and we think we can get out there and back and spread the disease, we're not going to fight this. We're not going to be able to be successful.
We're good. We're good. We'll do whatever we need to do. We're going to help people now. You just have to go on. It catches up with you at the end of the day. Definitely catches up with everyone. But when you're in the heat of the battle, you just got to go forward.
Wow, we cannot say thank you enough to the men and women on the front lines. Tomorrow on Wake Up Central, we hear from yet another Arkansan who dropped everything to go to New York and help fight this virus. Laura Monteverdi shares this nurse's incredible story tomorrow morning. Tonight, officials with the Little Rock School District held a virtual town hall to answer questions and address concerns about schooling at home during this pandemic. Their main message: everyone can take a deep breath.
We don't expect that the level of engagement to be exactly the same as is in a classroom. You know, parents are not trained educators, and so for K-5, that's why we are providing videos of trained teachers providing those lessons. That's why teachers are available to support. That's also why we've said that backed off to just math and literacy, that those are the 2 required components, and also just making the decision that no student's grade will be adversely affected during this time.
May 21st is the last day of school for LRSD, and May 8th is the last day for seniors. Superintendent Michael Poore says they're still working out plans for graduations. 2 pet cats have tested positive for COVID-19 this week, and now there's some new guidance about how you should interact with your furry family members. You've been sending us a lot of questions about this, so we've had our Verify team find out the answers.
2 pet cats in New York tested positive for COVID-19 this week. Let's start with the basic facts directly from the CDC. Both were pet cats in separate areas of New York. Both had mild respiratory signs, and both cats are expected to make a full recovery. The owners of one cat had been sick and tested positive with COVID-19. The other owners had not been sick, and we don't know whether these were indoor or outdoor cats. Now, many of you have asked us how this happened, because for months now, the CDC and WHO have said that pets likely aren't at risk of getting the virus. So what changed? Well, nothing really. The CDC and WHO were basing their stance on evidence, and so far, there's been no solid evidence that pets were getting the virus. But that was partly because animals hadn't been tested much. With these 2 confirmed cases, the CDC is updating their guidance on pets right now. They still don't believe pets play a significant role in spreading the virus, but they have suggestions to be cautious. Don't let your pets interact with people or other animals outside your house. Keep cats indoors when possible and avoid crowded places like dog parks. And if you get sick, unfortunately, you shouldn't cuddle up with Fluffy. The CDC recommends that you have another person take care of your pet, or at least wear a mask and wash your hands if you do take care of them. The CDC also confirmed that separate tests are being used to test animals and that, quote, animal testing does not reduce the availability of tests for humans. It is possible that the number of pets with COVID cases will go up as more testing becomes available. The USDA has a list of confirmed cases so far, but keep in mind it's a short list of only cats, and so far they've all been mild cases. Got more questions for us to look into? Send us an email. With your Verify, I'm Jason Puckett.